Today we are going to discuss about uveitis. Uveitis is the inflammation of uvea, any structure of the uvea or uvea as a whole. So what is uvea? Uvea is actually a single structure which is formed by the combination of three structures: iris, ciliary body or ciliary muscles, and choroid body or the choroid layer. So these three things combine to form uvea, and whenever there is inflammation of any one of these structures, it will form uveitis. This is an animated picture of showing the anatomy of the eyes. We are going to name some parts, okay, some important parts in the anatomy. We have to learn about these three structures from uvea. This is iris. Iris is the colored portion of the eye. Someone may have blue eyes, someone may have black, and someone may have brown. So this is the iris, which is giving you the color. Then there is ciliary muscle or ciliary body. Ciliary muscles or ciliary body is the part which controls the movement of the iris, and it is present. It is attached to the iris. So this is ciliary body. This is iris, and one other thing that is choroid layer. This is the choroid layer. Okay, this is the choroid layer. These three structures combine to form uvea, and when any part of this uvea, any structure of this uvea is inflamed, it means there is uveitis. Okay. Now what causes uveitis? Uveitis does not always have a cause. It may be idiopathic in most of the cases. So we do not know the exact cause in these conditions most of the time. But then there are some associations with this disease. The first is autoimmune diseases. In some autoimmune diseases like multiple sclerosis, sarcoidosis, and etc., patient may complain about the uveitis. Patient may have uveitis. And then it could be infectious diseases in the body, some endocrine diseases caused by these famous agents, tuberculosis, some patient having TB, or being infected with herpes simplex virus, varicella zoster virus, syphilis. So all of these conditions are found in association with uveitis. Now, how do we classify uveitis? There are actually 4 types of uveitis, and all of these are classified based on the location where the inflammation is occurring. So first, there is anterior uveitis. Okay. Now, what is anterior uveitis? Anterior uveitis is the inflammation of, let me write, inflammation of anterior chamber. Okay, this is the inflammation of anterior chamber. Now, what is anterior chamber? Anterior chamber is the chamber which is formed by the posterior layer of the cornea and anterior boundary of the iris. The portion in between is known as anterior chamber. This is anterior chamber, and this is the region between cornea and iris. Whenever the inflammation is in this part, it is anterior uveitis. Okay. Now, what is intermediate uveitis? Intermediate uveitis is the uveitis which is happening posteriorly to the iris and anteriorly to the lenses. Whenever the inflammation is in this posterior chamber, it means that this is intermediate uveitis. Okay, it will form intermediate uveitis. Now, what is posterior uveitis? Posterior uveitis when the choroid layer is affected, and sometimes since the choroid is very much close to the retina, sometimes we also see inflammation of retina with this thing. Okay, so this is posterior uveitis. Now, all of these types are based on the location where the uvei, which part of the uvei is affected. Different parts are when different parts are affected, they give you different types of uveitis. These are some examples, some types. The anterior uveitis, which is when there is inflammation in the anterior chamber, and it is common in diseases like TB, syphilis, and herpes simplex virus, varicella zoster virus, and inflammatory bowel disease. And then there is intermediate uveitis. Intermediate uveitis is when there is the inflammation in the posterior chamber, and it is also very common in TB and syphilis and IBD and sarcoidosis and sclerosis. Then there is posterior uveitis. Now, what is posterior uveitis? When there is the inflammation of choroid layer with retina, sometimes with retina, not always. But when there is inflammation of this layer, all of this posterior layer, it means that all of the posterior of the eyeball is being affected, and this is known as posterior uveitis. Okay. And then there is the last one, panuveitis. Panuveitis is when all of the uvea parts are affected. It means that all of the iris, the ciliary body, and the choroid layer from front of the eyeball to the back of the eyeball, all of the uveal layers are affected and inflamed, and this condition is known as panuveitis. Okay, so then there is clinical features. Patients with uveitis have all of these conditions. Most of the time they have painful red eyes, they have photophobia, they have decreased acuity. Acuity means the ability of the eye to see and distinguish things clearly. So there will be decreased distinguishing capability, so decreased acuity. Then there is synesthesia. Now, what is synesthesia and coapinodules? Coapinodules and synesthesia are two things which are very much most commonly found in anterior uveitis. This is an example of synesthesia. Now, what happens here is that the iris, the iris layer is sticking, usually sticks to the lens, and that causes the extensions of this iris layer. So this is synesthesia. This is very much found in the anterior uveitis. Okay, then there is another thing which is known as coapinodules. Coapinodules are also present most commonly in the anterior uveitis. You can see in this picture that the boundaries are not regular. They have been disturbed, and they are irregular boundaries. So this is also a sign of anterior uveitis. So these are all the things. Patient may complain about floaters. Patient may feel like things floating in front of the eyes. So these are all the common conditions the patient may feel in uveitis. Okay, now how do you make diagnosis? Diagnosis is usually made clinically by doing clinical examination and looking for signs like these, and then you have to run some tests to detect the underlying diseases. As I have said, that uveitis has no definite cause, but can be associated with other diseases like tuberculosis, like syphilis, like IBD, and some autoimmune diseases like sclerosis and sarcoidosis. So you have to run tests based on these things. Okay, you can run tests like Muntox test for TB. You can check the calcium level in multiple sclerosis. You can check the chest X-rays in sarcoidosis, and you can do the blood tests in syphilis, and for the detection of TB, latent in TB, and all of these diseases. They can be done to detect the underlying disease. Okay, this thing is very much important. Lab tests should be done before making the diagnosis. And then you have to check the eyes with slit lamp examination. Slit lamp examination is very much important. Then you can also do dilated fundoscopy, because anterior uveitis can be visible, but no one knows if the patient has posterior uveitis also in case of panuveitis. So to rule out posterior uveitis along with anterior uveitis, you have to run dilated fundoscopy. Okay, so this is how diagnosis is made. Diagnosis is typically very much easy, but you have to detect the underlying diseases by doing underlying tests accordingly. Okay, then there is treatment. How do you treat uveitis? Uveitis is, look, if there is inflammation and there is infection, so you have to treat two things. You have to treat the inflammation, you have to decrease the inflammation, and you also have to treat the pathogens and the underlying disease. So treating the infection is another thing, treating the inflammation is another thing. So you have to take both of the drugs, anti-inflammatory drugs like ibuprofen and NSAIDs, and you can take antibiotic based on the underlying disease. Depending upon the disease, you have to give antibiotic depending upon the underlying disease. Okay, and then you have to use the corticosteroids. Corticosteroids are mostly used in all of the conditions, except for the patients who are already very much compromised. So they have to be monitored. Okay, the treatment should be monitored. This is all the things along with pathophysiology, and I hope you understand. Thank you very much.